A record number of Americans have traveled abroad in 2016 for leisure, business, study abroad, and missionary work, to the tune of 67 million. Given the recent epidemics of natural disasters and security threats around the world, coupled with your run-of-the-mill medical issues, travelers have more reason than ever to ensure their health and safety are fully insured prior to embarking on their trip. Americans are dedicating more and more time to preparing for their trips and researching the coverage options available to them with good reason. Why have travel and medical insurance increased in popularity? Americans have in part become more discerning shoppers when it comes to travel and medical insurance because of the limitations placed on their coverage by the existing insurance plans. Once they step outside the USA, savvy travelers will be well aware that care offered in many remote or undeveloped areas is just not medically adequate for treating certain life or limb-threatening conditions or injuries. Suppose you need an evacuation to a higher standard of care. Most primary domestic insurance will not take on these costs or even assist with arrangements. This is a big gap you most likely have in primary policy, and one that shouldn't be left to chance. What will a good travel medical policy do for you? Travel medical insurance policies are designed to pick up where your primary domestic health plans leave off and will fill in these gaps. The most common plans will include coverage for big ticket items such as hospitalization, surgery, and medically necessary evacuations, as well as more basic service like physicians or office visits, ambulance services, prescription medication, and more. The premier plans will also include benefits for injury or sickness due to terrorist events and treatment related to pre-existing conditions. The seamless billing between the healthcare provider and ensure that these policies afford a credible peace of mind to the travelers who have historically had to absorb high medical costs and then claim expenses for reimbursement. Those planning on using credit cards in case of an emergency should be aware that some providers overseas won't be able to accept your card. Global provider networks. What good insurance if you cannot find a doctor you can trust? The best plan gives you access and direct pay to the best providers and are rich with primary and specialist resources regardless of how remote your location may be. In addition, providers are selected based on their medical credentials, language proficiency, and more. Always ask to ensure what their vetting process entails and the certification necessary for induction into their physician network. Richer benefit. For broader and deeper coverage with fewer surprises at the time of claim, make sure to inquire on whether your coverage includes pre-existing conditions covered to policy limit, terrorism covered with no excluded countries, cashless access to profile physicians and hospitals in 180 countries, coverage for medical evacuation. Healthy, safe travel. Ease peace of mind with a well-built travel medical insurance plan that allows you to keep your focus on your work, your studies, your missions, or just having fun visiting a new destination. As with anything in life that requires preparation, make sure to do good homework, read the fine print rather than scanning a benefit schedule, and ask important questions. A good idea is to request a sample policy from your broker or insurance so that you can get a complete picture of what you are purchasing. Looking to travel? Let's talk. Or you can find a plan on your own that will meet your needs. Go to www.conradihealthagency.com. Look for travel 224-433-5754, or like us on LinkedIn, Facebook, Instagram, and subscribe to our YouTube channel.